Welcome. What is up out there? This is hilarious. I never imagined I would be doing a YouTube channel, but I've had a lot of requests for specific questions on Instagram. And I thought the easiest way for me to get the information out to you without doing a 60-second quickly sped up reel is through this YouTube channel. So welcome to the Physio Julie YouTube channel. This is it. This is me. This is raw. I just got out of the pool this morning and I wanted to record this video. So my hair is a little bit frizzy, throwing on a headband, got my cozies on. We're going to jump into today's question, which is all about sacral and tailbone pain. So let's jump into it together. I had a question saying, how do I get rid of tailbone pain? It was not a very specific question, but a generalized low back, sacrum, pelvic pain. I can help you with that. I'm going to give you a few mobilizations, a couple stretches, and of course, we're going to pull out my favorite lacrosse ball and do some soft tissue techniques together. So let's go. Let's get started. I'll meet you on the mat. I'll get out of my cozies. I also have these super cozy socks on because it's minus a million here in the winter in Calgary. I will see you in a second. Okay, let us get started together with some exercises to help with the sacral pain, tailbone pain, or any pain generally in that low back area. So the question I had said, how do I get rid of tailbone pain from a fall? So if you have your sacrum, which is essentially an upside down triangle that sits at the bottom of your pelvis like this. So here is your tailbone. If you fall down, crunch, that tailbone can gently curve under and your sacrum can be gently immobilized in the incorrect position. Subsequently, your pelvic floor and your gluteal muscles can get tight. So we're going to work through that together. I highly suggest that you have a professional assess you in person if you have had an abrupt fall or an accident. If this is something that's chronic over time and you've already seen someone for an assessment, these are great adjunct exercises to add to your routine. So first, let's start with some movement. So think of your tailbone at the bottom here, where my pointer fingers are. So you're going to find it here, tailbone. So essentially, if you've fallen, that tailbone might be tucked under. So we want to gently open up and release some of that tension through the muscles there that are causing that pain. So come onto your hands and knees, and you're just going to imagine that you're going to be pointing up your tail or your sacrum, your tailbone up to the air. So you may have heard of cat-cow before. This is going to be more of a concentrated version. So really push your tummy down, push those hips up. Think about spreading into your glutes and really tipping that sacrum down to lift your tailbone. So we'll do a few together here. Don't worry if you don't have this much mobility. I happen to have a lot of mobility into my hips, which is a blessing and a curse at times. So just try to get your mobility there. Can you do it forwards and posterior tilt? Or anterior, posterior pelvic tilt. You may be familiar with those terms. Try a figure eight. So once you get the motion, then you really want to try to coordinate that movement into your pelvis. So I would definitely start with that if you're having the tailbone pain. Try to do that a few times a day. And you're just going to have to gradually increase your sitting time. If you're unable to sit at all, so you're going to have to start using a standing desk potentially, or sitting on a cushion may help if you're getting a lot of tenderness sitting on that tailbone. So you need to open it up, stretch out those muscles. So that's the first thing you want to do. really work into mobilizing your pelvis. Secondly, let's get into stretching some of the muscles around that area. So another one I love doing is called Happy Baby. So you come onto your back, heels up to the ceiling, bend your knees into a 45-degree angle. Depending on your flexibility, you may be able to grab the soles of your feet from the inside or the outside. If that's not available to you, you can take a scarf or a belt, wrap it around your feet, and hold on here so you have a bit more mobility. So breathing in here, letting that pelvis open up. As you inhale, really think about relaxing through your tailbone. So doing this after you mobilize for a couple minutes. And this is one thing we work on in my 6-week low back and core program. So I'll just put the little link for you down below in the description if you're interested in checking that out. 6-week program, 3 days a week, 20 minutes for low back and core. And this would also help to really address that tailbone pain as well. So once you've done your happy baby for 30 seconds to a couple minutes, slowly roll up, and then you can come into another pose, which I love for opening up the tailbone pelvic floor area, called Malasana. Depending on your flexibility, again, I'll go to the side for you. You can come up onto a pillow with your heels, and you're going to bring your elbows to the inside of your knee. So depending how much mobility you have there, you can come out a little bit wider, toes out at 45 degrees, and just sink. So just let your knees open up and that pelvic floor open up. Breathe into the muscles. Let your pelvic floor descend. So let your pelvic floor go down as you inhale. And I explained all of this further, more fully in the full program, of course. So just let yourself relax here. If you're getting acute pain or excruciating pain in this position, this is not the position for you. Go back to the happy baby. If that's uncomfortable, go back to the pelvic, gentle pelvic tilts in the cat-cow that we were doing first. So these are progressively getting more challenging, more difficult as we go. So now we're letting gravity and the weight of our body push down and open up into that tailbone area. So adding this to your routine is definitely going to help improve the mobility into your tailbone area. Fourthly, grab yourself a tennis ball. I like using this lacrosse ball. If you are not used to using hard balls for soft tissue techniques, I highly suggest starting very soft and moving into something harder. So I'm going to start with this today. And you're going to lay on your back, put your feet up for support, and you're going to come around and find the most bottom bone that you can find. Okay, that is your tailbone there. So you're going to stick the ball right next to it. You never want to put a hard ball onto a bony prominence. And then you're going to roll onto that side. One side's going to be definitely more tight than the other. Your tailbone may also even be pulling to one side very slightly, causing a lot of discomfort and pain. So just breathe here into it. Just let your body weight facilitate the stretch. Do a few deep breaths here, and then you can find more tender areas just by gently rotating your hip. So if you're having trouble finding time to do these during the day, try adding them to your evening routine. When you're winding down in the evening, maybe you're watching a show, having a cup of tea, try adding in some movement and self-care for yourself. Okay, switch it on over to the other side. Keep in mind that one side's going to be more tense than the other. So find your sacrum and work your way down to the very tip. You may get a bit of clicking. I just had a gentle adjustment there after that. And then you're going to find the tender point. You don't want to have any discomfort. If you have any pain or twinges here at all, you want to stop immediately. This is not something that where you have more pain, more gain. You're going to feel a bit of tension, but no pain. Definitely feeling it tighter on my left, of course. So just breathe into it here. Deep breath as you inhale. Tummy rises up. Pelvic floor descends down. So your pelvic diaphragm and your respiratory diaphragm work together. That's why we teach you, and that's why it's so important to coordinate your breath with your exercises. Couple more seconds here. Move that leg around. If you have any sciatica or nerve pain, be very cautious of where you're putting a hard ball. You never want to stress a nerve. Never want to roll out an already irritated nerve. So come back up, see how you feel. If you had pain in sitting, of course, it's not going to magically disappear with 4 exercises, but by doing them every day, just spending 3 to 5 minutes on this every day over the course of a few weeks, you're going to start to feel relief. I'd love to know in the comments, do you love these kind of videos? Are these helpful for you? Just rotating out. I'm going to be sharing my journey as well. So I'm going to be sharing exercises and tips and tricks that I have questions and answers for from viewers, from people on Instagram, Pinterest, all of the followers out there. I'm going to be sharing those. And I'm also going to be inviting you into my life like I do in my Instagram stories, but I don't have to do it in quick 60-second clips. I can do it more in the vlog style here. So thank you so much for watching. I will see you soon. I will see you back here, and make sure that you just keep moving your body.